everyone, and welcome back to Breaking Down Nursing, where we take all those intimidating machines and settings and make them simple. Today it's all about ventilators, essentially a very fancy, very smart air pump. Think of it as your patient's personal air DJ, mixing the perfect amount of breath to keep the party going. So if you remember back to that first day that you walked in and saw a mechanical ventilator for the first time, and there's all these pumps and machines and tubes and drains and dials, and made you just want to go into VTAC and then hit the door running? Well, let's kind of break it down. There are four key components to your vent settings. First being FiO2, or fraction of inspired oxygen. The second one you need to know is your PEEP, or positive end expiratory pressures. The third is respiratory rate. And the fourth is TV, or tidal volume. So taking a step further and breaking each of those down, FiO2, or the fraction of inspired oxygen, is the percentage of oxygen the ventilator delivers with each breath. It's kind of like adjusting your thermostat on your air conditioning. The higher the FiO2, the cooler, aka the more oxygen rich, the air your patient gets. Most of us breathe room air, which is 21% FiO2, because there's a mixture of not just oxygen molecules in the air, there's also helium and carbon dioxide, etc. But with a ventilator, we can pump that up to 100%, which would be our max if necessary. For example, in a critical situation for a patient that maybe has ARDS or acute respiratory distress syndrome, the FiO2 may be cranked up to 100%, while maybe a more stable patient that maybe just needs airway protection or something like that may hover around 40% FiO2. Let's talk about PEEP, or positive end expiratory pressure. So PEEPs are not the little pink bunnies that we eat during Easter time, the little sugary snacks that we all love dearly. PEEP is a really important part of our ventilator. And so the PEEP itself is a positive pressure at the end of the respiratory cycle. So as we exhale out, we allow our air to go exhale out of our lungs. And when that happens, for critically ill patients, those alveoli can collapse. And then we're not able to diffuse oxygen and CO2 across those membranes because the alveoli are no longer open. So PEEP plays an important role in that. They help to maintain the pressure at the end of expiratory phase that allows those alveoli to stay open, to allow for diffusion to continue to occur. And so our standard for PEEP, about 5 to 20 centimeters of water, although it really could be increased up to as much as a patient needs. So next on the docket is respiratory rate. This is how many breaths the respirator gives per minute. So imagine your ventilator as your very own yoga instructor. Inhale, exhale, repeat. The rate can be set to help your patients breathe faster or slower, depending on what their body needs at the time they're on the ventilator. For example, a normal respiratory rate for an adult might be 12 to 20 breaths per minute. But if a patient's in distress or has a certain disease condition, that rate might be higher or lower to accommodate for those needs. Last but certainly not least is tidal volume. So this is the amount of air the ventilator gives your patients with each breath. So think of it like ordering a coffee. If you order a small, or also known as a tall, coffee as the world calls it, your patient gets less air. If you go for a venti, they get the big gulp. Adjusting tidal volume is like changing the size of your patient's latte. So an example could be a typical tidal volume for an average adult might be around 500 mLs. But it can be customized based off of the patient's size and lung conditions. The taller the patient, typically the larger the lungs. If the lungs are stiff, we might have to dial down the volume because we want to decrease the risk of trauma to the lungs. How do providers decide how to adjust vent settings? So we get an ABG back from the bedside for a patient who's on a ventilator. Why would they change based off of their acidotic or alkalotic state the vent settings? Those four vent settings can really be dropped into two different categories: oxygenation and ventilation. And each one of those are adjusted based off of different settings. FiO2 and PEEP fall under the oxygenation category. And so when we look at those, we're really trying to change our PaO2. So what is the PaO2? Are they hypoxic? We would need to focus and adjust our FiO2, which is our percentage of inspired oxygen, or our PEEP, which then allows those alveoli to stay open to continue diffusion. When we look on the other side on our ventilation status really changes our PaCO2. So how much CO2 are we retaining? Are we becoming acidotic or alkalotic because we're blowing off or retaining too much CO2? We can adjust our respiratory rate. The faster we breathe, the more CO2 we blow off. The slower we breathe, the more CO2 we retain. But it's always important to keep in mind the patient's full condition and take into consideration the entire patient condition instead of just one number. Thanks for joining us on Breaking Down Nursing. If this video has helped you understand ventilator settings and maybe even made you laugh a little bit, don't forget to like, subscribe, and hit the notification bell for more nursing insights. Until next time, keep calm and keep breathing, or let the ventilator do it for you. Have a good one.